I usually start off the 2-semester sequence. And on the first day of the 131 class, I say that Americans tend to be very puritanical when it comes to talking about anatomy with regards to the reproductive system. We have a hard time saying words like penis and vagina and clitoris. And we kind of sort of need to get over it, especially if we're going into healthcare, because if you go into anything like OBGYN or urology, you need to be able to talk about the appropriate parts of the reproductive system without getting all silly. US has a checkered history when it comes to how we have viewed anything to do with natural sexual urges. Cornflakes was actually developed in order to help limit people's normal sexual urges and to help prevent people from masturbating. Charles Post developed both Post Toasties as well as grape nuts because he considered them non-stimulating foods. Again, he wanted to take people's focus off masturbation and sex. And also the graham cracker was given to those who had the awful habit of masturbating. If you take a look at this quote from Kellogg, daily bath is indispensable to health under almost any circumstances. For patients of this class, in other words, masturbators, it is especially necessary. Sun baths, electric baths, spray, plunge, and other forms of bath are of greatest value to those suffering from these effects of indiscretions. And the YMCA was, as it says there, basically developed to tire guys out, young men out, so they didn't fall victim to sexual vice. Because vigorous exercise fights the sin of masturbation. Kind of crazy. Vibrators were actually developed to help stop or prevent masturbation in males, and they had all sorts of rather unpleasant alternate treatings, which included putting leeches on penises to bleed them. There were locks, there were belts, there were devices, and for females, the belief was that hysteria, in other words, female emotions, could be relieved by the use of vibration, spit out by the use of vibrators. If you look at the way other cultures viewed sex, it was basically as a normal part of life because it is. The Egyptians had fairly rudimentary attempts to prevent contraception by using sheaths made out of various animal skins. And women would also have their equivalent, the age-appropriate equivalent of IUDs, and would use things like dung and mud dried together and placed up in the top of the vagina in order to prevent the passage of sperm. Victorians were particularly bad. Masturbation and sex were health hazards. And if you masturbated, you could go blind, you could go crazy, you could have heart disease, etc. So, circumcision. The US is the only so-called progressive and modern country where boys are circumcised as a matter of course. And there was no scientific evidence that it does anything beneficial. There's a little bit about Kellogg. What a guy, boy. He suggested or recommended that children have circumcision without anesthesia so they remember the pain. Holy cow. Let's get back to science.